It's actually a great pleasure. Oh, I see my research team here. I didn't notice you come in. I was just about to say that it's a great honor to actually share our work with the community. Both Sharon and I do work that is very engaged in community and with policymakers and practitioners. And obviously when we stand up here, we're presenting ideas and work that come from a whole team of people. And I'm lucky to have two of my esteemed team members here, Janaki Janthian and Catherine Nicol. So thank you very much for coming. We weren't sure exactly where everyone's understanding would be around self-management. So we've pitched this presentation at fairly broad general level, but we do have time for questions after, so we'd be more than happy to provide you with more detailed information if you're interested, or forward you information after. Great. So we're really framing this around getting what you want in terms of managing your chronic conditions is sort of knowing what to ask. And we're really hoping that during this presentation you'll get enough of a background around issues to perhaps know the kinds of questions and things you might want to pursue in your own life, or for families and friends. So this may or may not come as a surprise, but chronic conditions are really common. 1.6 million people in BC have one or more chronic conditions. And in Canada, I don't remember actually the exact statistics in Canada, but it works out to be about 1 in 3 people overall, and BC is pretty consistent with that figure. This is showing the most prevalent chronic conditions, and I don't know if people will find it surprising that depression, in fact, is the most common one in BC, followed by hypertension, osteoarthritis, asthma, and diabetes, and cardiovascular disease. So these are all quite common. So about one in 3, a third of a million have diabetes, about a third of a million have asthma, and nearly 1 million people actually have depression. Now, interestingly, in the research we do, we ask people to list their chronic conditions. And they list all the chronic conditions that I just showed you, but they also list a whole other wide range of things. And I've just put up some examples here. So like obesity, eczema, can't see if other ones are coming up here. Oh, restless leg syndrome, chronic leg spasms. Oh, there should be a few more coming up. Post-traumatic stress disorder. Sorry, there's a little bit of a delay with the computer here in going to the next one. Spinal cord injury. Chronic pain is a huge one that you might have noticed is not actually listed as a chronic condition when they do the stats in BC, but it's a huge one that comes up when we do our research. And sleep apnea. So really, what that tells you is that although we have a list of chronic conditions that tend to be recognized in the province, for statistical purposes, there's a whole wide range of other things that people consider to actually be chronic conditions in their lives. So in general, we define chronic conditions as health-related problems. It can include mental health issues as well as disabilities. They're considered to be currently incurable. Because some of them may be cured in the future, no one really knows. They last for an extended period of time, and they all create complex and challenging experiences in people's lives. Sometimes they're referred to as long-term conditions, chronic diseases. They're also sometimes referred to as non-communicable diseases. Some conditions, like for example cancer, is now largely considered a chronic condition because the survival rates have improved so long, and also things like HIV that were once not considered chronic conditions are now very much considered under the umbrella as well. So every person living with a chronic condition actually has almost 500 minutes in a day, and this works out to be about 43,000 minutes in a month. And this works out to, believe it or not, almost 500,000 minutes that each of us has in a year. If you think that the average person living with a chronic condition might have 6 appointments with a healthcare provider over the course of the year with about 30 minutes on average, that adds up to about 180 minutes. And what you can see is that in comparison to the amount of time we have, the amount of time we have in our whole lives, we actually spend a very small portion engaged with the healthcare system, even for most people who have chronic conditions. And I'm not trying to suggest that those minutes with healthcare professionals aren't essential or important. They in fact are and can influence what you do with the rest of your time. But I think it's important to recognize that when you live with a chronic condition, it's really what you're doing with the rest of this time that can actually make a big impact on your overall life and how well you do. So some of the things that people do in their daily lives are really considered to be self-management activities. And self-management, in the most broadest sense, just refers to any of those sort of tasks or behaviors or activities that you engage in that are to try to help you deal with the emotional, physical, spiritual, and social impacts of living with chronic conditions in daily life. Now, in our research, we ask, and my research is predominantly around women at the moment, we ask people what self-management means to them and what it looks like. And we get all kinds of interesting ideas. So Linda, when we asked her what self-management meant, said, just understanding the problem and realizing that there's a certain amount that I could do. Natasha said, it means to be able to access the resources and programs that are out there now. Jane said, trying to manage at home without medical care. Tora said, it means to use all the information I've gained from a variety of sources to make the best choices each day to be healthful choices, emotionally, physically, socially, spiritually, in every way. And Sapphire said, it's really about learning how to deal, how to cope with the illnesses that I actually have. We just have a couple more here. Ivy talked about self-management in relationship to feeling in control of her life. And Cyrano said, I shouldn't be around any stress at all. I should be living where I can have some control over what I'm exposed to. So what you see is that different individuals living with chronic conditions associate different kinds of meanings with what it means to actually sort of take care of yourself and manage your chronic conditions in daily life. Sandy, I forgot her, she talked about independence. I guess for sure self-reliance, sort of taking responsibility for yourself and being your own health advocate. And I think there just might be one more on here. Michelle said just taking care of yourself, making sure that you do the exercise, mental meditations, eating, going to the doctor, and things like that. So in our research, and what is sort of shown in the broader literature, is that a lot of people think about self-management in relationship to these kinds of ideas. Being in control, taking responsibility, being independent, making choices, solving problems, accessing resources, learning, engaging in healthy behaviors, being a health advocate, and engaging in activities at home and daily life. So there's extensive research to show that really what you do in your own personal time in your day-to-day life to take care of your chronic conditions actually matters. So we know that the risk factors for getting a disease, which are things like physical inactivity, being overweight, smoking, and stress, which can increase your chances of getting chronic disease, are also the same things that influence how you do once you get a chronic disease, and can potentially cause you to have more than one chronic condition. So we know that programs which are largely grouped into things called lifestyle modification, like exercise programs, diets, smoking cessation programs, and relaxation and stress management kind of things, can actually try to reduce those risk factors and influence and hopefully lead to better outcomes once you live with chronic conditions. Now, I apologize for the complexity of this slide, but the only reason I have it up here is just to really show you, it's by Anne Rogers in the UK, who does a lot of innovative work in the self-management field. This is the time you spend in the healthcare system and the healthcare system and healthcare professionals. And this is self-management and all the things you do in day-to-day life. And I'm not sure how easily you can read that, but over on the far side it says everyday life. And this is interactions with other people with long-term conditions. This is about your personal communities and the social networks that you have in daily life. This is about the voluntary and community groups around you, and these are all the non-health providers that you encounter and interact with every day. And all of these interactions can be part of self-management if they're helping you to live and support the way you manage with your chronic conditions. So what other people do to support you is also really important. And there's a distinction made between the self-management, which is what you do as an individual, your behaviors and thoughts and so on around your chronic conditions, and what other people do to try to support you and to try to help you improve or change those behaviors. So right now in Canada and in BC, governments, health organizations, community organizations, and nonprofit illness organizations are all working to develop initiatives that will really help to support people living with chronic conditions. And there's an enormous amount of activity going on because of the enormous impact of chronic conditions on society and the projected increase with our aging population. Enormous amount of resources are now being pumped in to try to find ways to support people at home. And this is just another way of looking at it. You can't really see the line here, but self-management is usually situated on the interface between health systems and community. And some of the basic principles are that this is kind of called the BC Expanded Chronic Care Model, is that the whole foundation, philosophical foundation of self-management is that it's the individual who's empowered and engaged, as well as having an engaged and proactive community. So just to give you some basics about self-management programs and interventions, usually they're behavioral change techniques and theories that are trying to make changes in your lifestyle. The programs can be for specific disease groups, so they can be for diabetes, heart disease. They can be for different ages, so they can be geared towards elderly, adults, or teenagers. They can be focused on specific ethnic groups or language groups. They can be written in certain languages. And sometimes, although this is quite rare, the programs are developed for parents or caregivers of people with chronic conditions. The programs can be offered individually, one-on-one. They can be offered as a group or online, and they can be delivered in a wide range of settings. So this is just to say that in the whole sort of range of things that are out there to help people live better with their chronic conditions, some are really focused on information like booklets and pamphlets and online sort of educational programs, and some are much more geared towards actually teaching you how to change your behavior. Some are focused on the technical skills, and some are really focused on helping you build confidence. I'm not going to go through all these in detail, but I'd be happy to provide any more information after. But BC, this is just listing the whole range of programs that exist right now in BC. One of the most common ones that some of you may have participated in or know about is the Chronic Disease Self-Management Program from Kate Lorick at Stanford. And it's a 6-week course taught by other people with chronic conditions. It's being run out of by Patrick McGowan's research group at the University of Victoria, and it's offered in all kinds of different community settings across BC. They have general ones where anybody with a chronic condition can go. They have them for arthritis, fibromyalgia, chronic pain, and diabetes. They have them in English, geared for First Nations, in Chinese and Punjabi. And there's also a whole other range of things. There's a bounce back program that's solely to help people manage depression, run out of Impact BC. There's active choices to try to, it's a one-on-one telephone support to help you with physical activity. There's a Patient Voices Network, a peer coaching phone program. Now some of these are geared only towards people with chronic conditions, like the first one here and this one here, Bounce Back, and some are for the general population, but a lot of people with chronic conditions actually use them. And I'm not going to go all through these, but these are the kinds of content areas that are often in these self-management programs. Sometimes the program is only specific for exercise, sometimes it's specific for nutrition, but more often than not, you see programs that have modules, and every week you learn something different. And so these are the types of topics that are generally found in most of the programs, or many of the programs. Research shows that these programs do make some difference. It's a relatively, the knowledge is still really developing, but one thing they know for sure is that they seem to be most effective in actually improving people's confidence. And in academic world, they often use the term self-efficacy, and it's really about a person's belief in their capacity to actually learn and perform a specific behavior. So your belief in your ability to change something seems to be as important or more important than actually doing it and engaging in it. Okay, thank you. What we don't know yet, there's a lot of things we don't know about these programs. We do know that they make small to moderate effects in psychosocial outcomes, your sense of well-being, your level of confidence. Sometimes they can help change your health behaviors. But what we don't know when we put them all together in these kinds of packages is we really don't know which piece is the most important or making the biggest difference. We don't know whether generic programs that anybody can attend are more effective than programs that are for specific diseases. We don't know if these programs make a difference over the long term because most of the research has been over 4 to 6 to maybe 12 months. And everybody knows that people with chronic conditions often have them for a lifetime. And we don't know how well they work for different groups of people because they've largely been studied on certain populations and less studied on, I would say, more vulnerable populations overall. So there are things people can do in their life to help themselves self-management, but there's definitely some things we know that make it harder for people. And in our research with women, we had women, when we asked them how they self-managed in the midst of their complex lives, they said things like, if somebody else had the same identical type of asthma as me, but had the income and family and a husband and kids, their life would be a lot different than mine. You know, a single mom on low income, if I had more support financially and emotionally, then it would, of course, be much more easy to manage. And Natasha said, especially when you're an immigrant, you don't have so many friends because most of your friends are back in the country. So when you're stressed out, you don't have so many friends to talk to. So self-management behavior is really the result of a large numbers of factors and processes that operate together in complex relationships. The programs I've described really quickly so far really focus on trying to improve your knowledge and your skills and your confidence. But what we know is that that's actually not enough. And I won't go into this too much detail other than to say that the behavior and the way you act in life is influenced by your environment, your work environment, obviously your psychological and biological makeup and your personality, and your genes and your culture. But we can no longer just assume that by helping you to increase your knowledge and some of your skills, that in fact we can always change these behaviors easily. And this is just another way of looking at it. This is self-management behaviors down here, and this is where most of the programs focus at the individual level. But now research is starting to know that we need to be looking at the social environment, family and social networks, and community and physical environment in really trying to support people to live better with their chronic conditions. And I don't have time to go through studies in each of those areas, but I'd be happy to follow up if anyone would like more information. So what we do know is that different populations, because there's that broad range of factors that actually influence the way we live and behave in life in general, and obviously when we have a chronic condition, we saw how we self-manage, we know that different populations can face different kinds of challenges in managing their conditions. And I now want to turn it over to Sharon, who's going to give you an example from her research of working with older immigrant populations on some of the findings of some of the challenges they face.
Career has really, my research career has focused not so much on chronic disease as it has on a particular population, which is immigrant seniors, over the last 20 years. And this year, I paired up with Sue to host a forum with different stakeholders looking at chronic disease and chronic disease self-management specific to immigrant older adults, because we know that older adults in general experience more chronic diseases. As you get older, you're more likely to sort of collect them along the way. And there are a lot of comorbidities amongst these chronic diseases. So I saw a statistic the other day that showed that the vast majority of people over 70 anyway are going to have 7 or more chronic diseases that they're trying to juggle, and which comes first. So I think that the focus on an older population is appropriate given that higher exposure, and especially I think we need to consider immigrant older adults, because what we do, if we address the challenges that immigrant older adults face with the additional barriers that they face, then basically we can satisfy ourselves that we can address, universally all the different kinds of challenges that we find in the population, or at least we're beginning to move in that direction. So that's why I think it's really critical to look at highly barrier populations or potentially barrier populations like immigrant older adults. So why is it then that this particular group of individuals, sorry, I think I went the next one, may face challenges in self-managing their diseases and or accessing the supports they need in order to do that? One of those barriers may be culture, but culture is often also mixed up a little bit with a lack of knowledge. Sometimes people have beliefs such as the fact that, a chronic condition is part of normal aging, and that, really you just have to suffer it out because this is what it's like to grow old after all. But quite frankly, I've heard the same kinds, people say that it's part of the religion, that we suffer and so on and so forth. But I've heard the same kinds of beliefs coming from individuals who are older, who don't come from cultures where the religion dictates that sort of orientation. So the thing is that we are now living older than we ever have. And our grandparents may not have lived long enough to have lived well or lived even with chronic conditions. The reason we're seeing more chronic conditions in our populations is because people are living older and we're better able to treat them at the acute stages of the disease. So a lot of what we see as cultural is actually the result of a lack of knowledge that what people are experiencing is not just old age, it is in fact due to living with chronic conditions. So that needs to be explored. That's one of the questions you need to ask yourself. Am I feeling this way because I'm just not coping with getting older, or do I in fact need to get this checked out, and is it something I could manage? Now, language, of course, complicates a lot of things. If you do experience language barriers, it's hard to communicate, it's hard to get around, it's hard not to be dependent on others for interpretation, for transportation, and so forth. And it also influences the kind of support that you might get out there in the community because, for example, people who were providing chronic disease self-management supports at the community level said that they had a hard time in a program aimed at Chinese seniors because there was no equivalent word for arthritis, and it sort of translated as joints. And so as a result, there was some misunderstanding and mistreatment as a result of that. So the other piece is connecting to services, and I'm not just talking about connecting to medical services, but connecting to the sorts of community services that help people to manage as well. We need to be connected to others in our community. It's not always medical care we need, it's often networks and supports. And if you don't know the system when you arrive here, if you don't understand our social system, it is much harder to navigate that. So immigrant seniors are at a definite disadvantage, but frankly, we have a very, very complex, just to look at the healthcare system, we have a very complex healthcare system, and very few people are able to navigate successfully through it. So you sort of extend that to the rest of society and all of the different systems that we have in place that might help people to self-manage and get the services they need. And you see that, for older adults and particularly for immigrant older adults, that can be very challenging. Support networks, as I mentioned, are also very important in terms of self-management. And one of the things that we often assume is that when immigrant older adults arrive here, often they're sponsored by their adult children, and we think that in because of that, they're situated in these dense supportive networks. But that isn't always the case. Often those younger family members are busy working. They're trying to make it as new immigrants themselves. So they're, working a lot. Kids are at school. They're trying to get ahead. And the immigrant senior is often left very much alone, which can put them at a huge disadvantage, because if they don't have the language skills in particular, and they don't have the knowledge of the system and how to get around, and the terrain and the weather and so on and so forth, it's very hard for them to connect with others. And so that is something that we need to think about. Another issue that immigrant seniors face, and many grandparents may face too, is that they want to provide assistance to family members by providing childcare. So this is an extremely valuable service in our society, something that we owe a great debt to them for, but it can isolate them considerably too. So when we provide resources at the community level, we need to think about transportation, we need to think about childcare services for grandparents who need that in order to participate. And some services are doing that. And then, of course, the other issue for many seniors, particularly older immigrants, is that they're on a fixed income, and there's not a lot of money to go around. This is especially true for immigrant seniors who are sponsored, because they are financially dependent upon their sponsoring children for 10 years. And even when they are past that 10-year period, they're only eligible for a quarter of the old age pension, because you have to be here for 40 years after your 18th birthday to qualify for a full pension. So some of the things that happen that we heard about at the forum are that seniors, and I've heard this about other seniors, not just immigrant seniors, is that seniors share medications. But of course that can be very dangerous, because they may not have the same conditions. And, oops, sorry, I went too far there. The other little piece that flashed up there was that they may not even be able to afford transportation. And again, that makes them much less flexible to be able to self-manage. So if there isn't a suitable bus service, if, for example, they have arthritis and they cannot stand at the bus stop for half an hour waiting for the next bus, they can't just call a cab, as many of us would do. They just don't have that financial flexibility. So we need to bear that in mind as well. Even very small membership fees can be, at recreation centers and so on, can be a disincentive for older adults to participate. There are issues as well in the doctor's office, and some of them have to do with ageism and racism and so on. And here we're focusing on self-management. So as we mentioned, really the key is what you do yourself. But those minutes in the doctor's office matter. So we really need to be sure that in the doctor's office, these doctors are trained to be sensitive to the ageist beliefs that they have, and the racist beliefs that they have, the preconceptions they may have about different cultures, and how much an elderly person can actually get out of different kinds of supports. And the physicians as well need to be taught where to send people, what kinds of advice they need to give to patients so that they can self-manage. Not, here's your chronic disease diagnosis and off you go. You'll have to find some supports out there in the community. Where do they actually go? We need to make some very solid connections between physicians' offices and community services that can help people self-manage. So part of that is cultural competence and so on. Now, very quickly, we just wanted to talk to you about future directions, because people with chronic conditions, as I hope you've been able to discern by now, are really part of a large, complex system. We need to look at individuals, families, community resources, policies, and so on and so forth, the larger system. Sorry. And so Sue has done a lot of work putting together a group, an international panel of experts in this area. And what they identified in their international self-management supports framework is that you need activities in many different areas. You need to promote patient engagement, as we've been discussing, in many different ways. There needs to be a menu of self-management programs, because there isn't a one-size-fits-all. We need to address the different vulnerabilities of particular populations in the way that we target them, in the way that we do outreach. And to do that, we have to create linkages within and between community, social, and healthcare sectors, as I was just saying, and also to train healthcare professionals so that they can provide, so that they understand health literacy, so they understand cultural competency, and they can work with all of their patients appropriately. We need to embed self-management support in chronic disease management, and particularly in primary care, so in the physician's office, and promote self-management support leadership in all of these areas. And so in order for that to happen, there needs to be infrastructure to support it. And in order for the infrastructure to be there, then there have to be policies underpinning them. And to move forward, we need to advance research in the area so as to generate more knowledge. So we're just going to show you very briefly this stepped care for self-management support model, and I might have to press many times. It's a model that physicians and other healthcare providers use, particularly developed for Aboriginal Canadians. But all we really wanted to show you was that this is a model that is out there being used to support people with chronic conditions. And right at the very base of it, I don't know if you can see, is honor culture. Communicate clearly and promote active self-management. And these pieces have to be in place before you can even move on. Because if they're not, then you have to go to the medical piece, which is, actually comes at a greater cost to everybody, to society, to the individuals involved, and so on, because what they really need is the appropriate support. So I'm pressing the wrong arrows. Oh, there we go. Okay. So one of the things to bear in mind then in offering those services is because of culture, because of our life's experiences, our different bodies, and so on, everyone is unique. And there needs to be a menu of options, and we need to look at those options and provide evidence that they work. So that's our role as researchers. And what we need to move forward with then is this whole notion of, yes, you have a personal responsibility as somebody with a chronic condition, but your issue is bigger than that. The reason that you have a chronic condition doesn't just reside with you as an individual. It is a larger systemic thing. So we need to move on towards, shared responsibility. The idea that behavior change involves creating a supportive environment and building community capacity in order that people can do that. We need to therefore embed self-management interventions into a broader structure of support. And instead of focusing on single diseases, we need to look at multiple conditions and complex needs, because very few people are just dealing with one thing. And many of the things that you need to do for one condition are equally true for another. And also often come back to those what we call social determinants of health, the environment that you live in and the supports you have. The other thing that we need to consider is that physical and mental chronic conditions also interplay. People with higher levels of depression are less able to manage other kinds, both the depression and other kinds of chronic conditions. So if we don't think about them together, then we're not going to get very far. But the thing is, our system is divided into mental and physical health, and they often, work alongside each other rather than together. And so we need to move research and demonstration projects into ongoing programs to promote sustainability. We need to not just have, pilots that don't go anywhere. There has to be some sustainability to these innovations that we identify. So thank you so much for listening and providing us with your attention. We'd really like to hear from you about the sorts of experiences you've had. So, we've put these questions up there, in case you're stumped. But if you have burning questions, we'd love to field those too. But, if not, maybe you can tell us about whether or not you're able to self-manage a chronic condition and share what works, what doesn't work, what some of the barriers might be. What sort of supports do you think would help, and what other kind of knowledge do you need to move forward? And please direct your questions to either of us. And I think for that, we need to use the microphone up here. Is that correct?
Just don't worry about it. It's all, we'll hear it.
It's all good. Okay. All right.
Use example of ageism as that stereotype that you're just old as part of old age. And I experienced when I was in my early 20s that kind of attitude, but I was actually in my early 20s and the doctor was projecting their own feelings as they were pushing retirement. None of us are getting any younger. How do we break through that barrier and get them to see that this isn't a normal part of aging or a normal part of life, that our problems that we're experiencing are abnormal and they need to look at it in a different manner?
Yeah. There is a thrust in gerontology now that instead of focusing on barriers, talks about living well with chronic conditions. I hold a position at the Department of Gerontology at Simon Fraser University, and a number of people have focused considerably in that area. Lillian Zimmerman has a wonderful book out there that I think really speaks to people who are older themselves, living well in old age. I think that message is starting to get across, and it's going to be, a relatively slow process of culture change. Other initiatives are out there as well. There's a funding initiative right now that wants to look at what it is to live well with chronic conditions, and and includes people from the gerontology unit. So, we are always pushing as gerontologists to combat ageism. It's always a barrier for us, but I think it's like many things, a matter of, as people are living longer, and particularly as you see baby boomers becoming, huge numbers of seniors, these baby boomers are not passive. They're on the internet, they're out there, and they're going to be spreading the message more loudly than anybody else. So I think, there's hope.
But are there any specific maybe words or phrases that you think we could possibly use as a patient speaking to their doctor that might be helpful?
Well, I think you just need to remind the doctor that, yes, there are many things that are part of aging, but there are many things that we know how to live well with now, and that, the whole thing is, BC is promoting healthy living and so on, and there are a great many messages that you could refer to the doctor to if you just send them to the Government of BC websites, the healthy aging, healthy living websites. I guess over time, people holding those positions are going to retire out of them, and because I think a new generation of physicians is more geared toward the health promotion orientation. So, but go to those websites because they might give you some ideas as well. Yeah.
Thank you. I was just going to add, I teach medical students, and I think it really starts there.
Yeah.
It's all about the way we teach students coming through the system how to understand aging and these processes. And I know there's steps at that level too, to try to shift some of these understandings to more progressive notions and to challenge some of those preconceived notions. So.
Yeah, but there still isn't enough training for medical students. They still need more, definitely, around aging and around cultural competence as well.
Chronic conditions as well from a lived experience.
Yeah.
Because they get the science of it, but they don't necessarily understand what it's like to live with it and self-management.
There's a question online. This is Leanne from Vancouver. Her question is, are there gender differences in the approach to self-care?
That's yours.
I'm not I work in women's health, so it's more challenging for me to speak about men's health. But from what I understand, in general, men are more resistant to self-care. It's a different issues of identity, and even in the communication processes with doctors is quite different from males and females. And most of the programs that I was talking about, the chronic disease self-management programs from Stanford and so on, are largely attended by women. and the content has largely been developed from women's experiences. So as much as I'm a researcher who promotes actually focusing more on women who are in vulnerable and disadvantaged populations, I think the simple truth of the matter is we don't know a lot about men in self-management yet. Men's health has become an increasingly important topic. I think this series had male health, John Orliff speak on men's health at one point, I think. But I've sort of started to have preliminary conversations with some of the researchers working in men's health about the whole self-management piece and how are we going to bring the male perspective into it. But as it stands right now, it's largely, these self-management programs at least are largely being used by women, and we do know for sure there are differences in the way they think about taking care of their chronic conditions. Sound effects. Oh yeah. It's for, yes, Alan?
Why, Sharon, what is the role of spouse in self-care?
Great question. Well, I don't think there's, a definite answer for that. I think that what we do understand is that people's support structures, and there's some very interesting research going on out of the UK on social networks and communities and the role of families and support structures. And we do know that it plays a huge role in how people are able to cope, how people cope and manage. In any individual circumstances, I think it just depends on the nature of that relationship and the person's capacity to actually support. I think people in general, research would say that having knowledge, having your spouse and people around you educated about your chronic conditions is a really important first step. There are some programs, I don't think we have any in Canada, but I don't know, you might remember, Janaki, I don't know if you remember from the policy thing, didn't we find a program that was for couples somewhere in Canada? I know I'm putting you on the spot here, but we did an environmental scan of all the self-management programs across Canada in the last year, and also the policy documents that were addressing self-management. And I vaguely remember that there was one that was actually geared towards couples, and couples could attend it. So more and more, I think there's recognition, although these programs were developed as individual programs, you go there, you learn yourself. Now people are encouraged to bring spouses and families, and it's considered to be sort of a mutual process. In some cultures, and some of the work that Sharon's done in one of the workshops I was at, in some cultures self-management is considered to be a community and family activity. It's not even thought about as something you do for yourself, because that notion of community is so embedded in some cultures. So that's sort of a general answer. I'm sorry I'm not an expert in, in spousal support of chronic conditions, but that's what I know of generally. Yes.
Just that being said, I think we'll probably learn from other people's cultures, because from, say, your partner's personality and their level of patience, they'll probably learn from other cultures and how it's not just that single person who has a chronic, I don't know if it's saying problem is the right word, but they'll then be able to maybe look at a wider perspective to how to deal with this ongoing chronic situation.
Yeah, I think, if I understand you correctly, I think we do have a lot to learn from these other cultures, because I think that there's a number of cultures out there who have had more experience at how to support from a community vantage point than I know personally my own culture seems to have. And you're right, I think we could learn from those cultures, even in the field of self-management and chronic condition management. I think the essential thing is to really understand, though, where someone's coming from and what their culture is and how they look at it and what they see the role of the spouse or the role of the family member being, because it's quite different for different cultures.
Yeah, and if I could add too, I think sometimes we make assumptions, as I said, that support is there when people are there, but that's not necessarily the case. And again, it comes back to what we call the social determinants of health. When people are new immigrants, they're under a lot of pressure, under a lot of financial pressure. So the likelihood that people will actually be around and able to take time off work. I work in a job that is quite flexible in terms of time. you know? I'm busy all the time, yes, but if somebody needs to go to an appointment, I can change my schedule around. When you're working in a service industry at minimum wage or less, you know, that's not easy to do. So,
black and white with probably very little gray.
yeah, exactly. So, yeah. So, you know, we really need to look at the conditions of people's lives and the sorts of ways that they can be flexible or not. And, you know, to put it bluntly, the less money you have, the less flexible you can be. But that said, you know, there is a great deal that people do for one another in different cultures that we may see as, you know, beyond the scope of what we do for one another in Western culture. That said, Nina Chappell, who is, you know, one of Canada's leading gerontologists, will tell you that in fact Canadian families do a great deal more for their seniors than we are led to believe. So, you know, we shouldn't sell ourselves so short either.
No, and we have each other. I hope that I didn't come across
No. But we do have a great deal to learn, all of us, I think, from each other. I think that's a very, very valid point. And to see, you know, how differently we might think about our social networks. And certainly people are very inhibited to reach out, you know, when there is a health crisis in the family, and, you know, especially among seniors who often think, you know, coming from, say, a British background myself, seniors in my culture don't like to let the world know that they have a problem. They're very stoic. So, you know, we need to get over that. We need to reach out. It's extremely important in managing chronic conditions and in living well in old age in general. So.
Another online question. Is charting important in self-care, perhaps a journal or diary?
Well, I'm certainly not an expert in that area. I don't know if you are, Sharon, but I've come across, and certainly come across some literature from the broader vantage point about how writing things down and journaling them, they know makes a difference in the way people are able to manage and cope with health issues overall. Specifically in relationship to self-management, specifically in relationship to self-management, journaling and sort of diaries are built into some of these self-management programs as one of the techniques. I don't know if I've come across any studies that have studied them specifically, but it's quite possible that there is some research out there. But I think generally speaking, some of the self-management programs encourage people to actually learn how to make sense of their test results, how to even plot them if they want over time, and how to sort of write about their feelings and how they're coping. So I think it's considered to be sort of one of the pieces overall. It's kind of interesting and fun that you can get questions from people that you can't see.
Yes.
Out in cyberspace.
Exactly.
No questions from my research team. Nothing burning, eh?
We should probably acknowledge our sponsors.
Yes, we should, yeah. And also the research teams, as I mentioned, we have a few people here, but I'm very fortunate to have people who are in the Ministry of Health and who work for Vancouver Coastal Health and several different universities on my research teams. So we're very much, to try to come at this from more of a holistic systems perspective, we very much are doing research with the people out there doing things in various levels, physicians, healthcare providers, policy makers, program planners, and consumers, and people that are actually living with illness. So yeah. I think that's really where we need to go in the future to be able to tackle some of these complex linkages and you know, integrations between sort of health and social and community systems, which have tended to be separate kind of entities out there. Self-management is really on the bridge between them, and so we need to do a better job of how to figure how to integrate things and link things.
That's very much how we work too. That's how I know Sue.
Yeah, that's right.
The eye care team.
We all connect.
Yeah.
Okay. So any other questions online, or is that it? No? Okay.
Okay.
Thank you very much for your attention.
Well, I'd like to